Thank you, Cathaoirleach. Thank you, Cathaoirleach. And Minister, you're very welcome into the House this afternoon. I strongly object to the extension of the Act on conferring power on the Minister to impose lockdown restrictions on the nation from this day until the 9th of June 2020, as set out in Part 3 of the Health Act 2020, No. 1 of 2020. These repressive measures have been railroaded through both houses without adequate time for debate and scrutiny as to whether they're actually necessary and proportionate. As the government lurches mindlessly into another disastrous lockdown, there are already mutterings from the Taoiseach about future lockdown cycles in the new year and beyond. Lockdowns prolong the increase of suffering of everyone. When is the government going to learn this lesson? When the people of the state are both broke. Our current hospital waiting list is almost at 1 million. 1 million people waiting on procedure and to see a consultant. Let that sink in. This government is doing its best to ensure the state and the small Irish business go bust. It is unforgivable that this government bases the health and wealth of this nation on football and alcohol. This minor distraction was only for the public to take their eyes off the game that this government is failing to play to save lives and livelihoods of its people. Is the level 5 lockdown all the government and NPHET can come up with again? We have 34 confirmed cases of COVID-19 in ICU. Is the hospital system overwhelmed by COVID-19, or was it ever overwhelmed by COVID-19? Is a lockdown really justified, or is it really the only answer because this government failed to find and provide effective solutions? Even the WHO does not actually advocate lockdowns. The WHO has urged governments to learn how to coexist with this virus in a way that doesn't require constant closing down of economies, but at the same time in a way that is not associated with high levels of suffering and death. Our government is failing to do this. The Great Barrington Declaration has been signed by over 3,500 eminent scientists and doctors. It sets out a balanced, science-based strategy of focused protection to deal with this pandemic. Essentially, protection and protective measures must be focused on high-risk groups, the elderly and those with pre-existing medical conditions. The government failed to protect the vulnerable earlier in the pandemic, with over half of the deaths in care homes. At the same time, they did immense harm to the health, social life, economic and cultural fabric of the nation with lockdown. This morning in Galway, 26 out of 28 nursing home residents have been diagnosed with COVID, with 1 nurse and 1 carer available for the last 72 hours. All other staff had tested positive. It is unconscionable that a GP would have to resort to Twitter to get help for this nursing home from the Minister of Health. The latest fiasco of the tracing is just another calamity of the government. Why is the Department of Health and the HSE not on the same page? Does the left hand not know what the right hand is doing? Why did the HSE hide the mess on tracing from the Minister of Health? Why is the school tracing and the reporting system so slow? In the North East, only 1 phone line is available in the HSE offices to allow queries from schools in Louth, Meath, Cavan and Monaghan. This government, like the previous government, is mortgaging the nation's future to the tune of $50 billion in pursuit of a flawed lockdown policy. My children and my grandchildren will be paying for this woeful negligence. Compliance with a lockdown cannot last forever, particularly in a free and democratic society. The measures proposed by this government last night and coming before this House to fine people for breach of lockdown rules is simply a step too far. How many in rural Ireland live more than 5 kilometres from major supermarkets? There is real fear this morning among the people of this nation. This must be extended to 10 kilometres. No home can be entered to by Garda without a warrant. Let us be very clear about this. Part 5 of the Emergency Measures in Public Interest COVID-19 Act 2020, No. 2 of 2020. This measure continues the amendment of the Mental Health Act up until the 9th of June. Could a workable solution not be found to deal with the people suffering from mental health that are detained currently under the Act. You even admit yourself, up until this week, that everything has been working fine and these measures may not need to come into effect. So why put it into the bill if it's not going to be needed? Surely psychiatrists and tribunals could perform examinations with PPE equipment available to all other medical professions. Once again, this legislation is rushed through the House with little or no thought of the people it will affect or their human rights. This government came up with a plan to living with COVID. Compliance with that plan has proven unsuccessful, bringing the public with us. So now the government is reverting to Plan A, which is lockdown. Punish the people. The Living with COVID plan could have been tweaked to ensure public buy-in, to ensure the spirit of the nation was with us. We, as in all politicians, failed in our messaging. Some of us have displayed reckless behaviour, and it is no wonder we failed to bring the public with us. Heavy-handed policing and the imposing of ad hoc fines is not the way to encourage people to limit their social contacts. We have to learn to live with the virus, not merely to exist in a state of indefinite lockdowns extending into the future. This is not living. We must do better for the people of Ireland.